Hello and welcome to our newborn photography safety series brought to you by StandInBaby. My name is Sandra Moffat, and in an effort to make sure that we bring you all the information and facts relating to newborn safety, joining me throughout this series is well-respected neonatal nurse Anne-Marie Feary, who will be advising us on the essentials to safely working with newborns in a studio environment. In this tutorial, we're going to talk about safety issues with newborn photography. But before we start, I'd like to say that if you are unsure about anything you hear during this series, please seek advice from a medical practitioner near you and get the answers that you need. If you have been given information from other sources, make sure it's a reliable source because the health and well-being of our clients should always be put first. We will be demonstrating throughout this series with a StandInBaby because I not only want to point out what to do, but I also want to point out what not to do and the consequences of that, which clearly we can't do with a real baby. So let's get started. Thank you so much for joining me, Anne-Marie, and helping to educate our industry on newborn safety in a photography environment. Now, I know that you actually have been working with newborns. You're a neonatal nurse, and you're currently actually advising the government right now. Explain a bit more about that.
So what I'm doing is I'm actually a clinical nurse consultant, and I am reviewing evidence-based clinical neonatal guideline. I'm also doing a PhD, and I'm looking at how the space of a single family room influences parents' behaviour and experiences, and if those experiences, if it actually facilitates preterm infant and parental closeness, if it brings the parents and the baby closer together.
Wow, so you actually know quite a lot about newborns, and especially the neonatal newborns. You've actually worked in the neonatal units, haven't you?
I have.
And so photographers, we actually, I personally work with babies between 3 and 10 days old, but I know that there is also some people who work from 2 days old called 48-hour fresh sessions. And so what are some of the things that we as photographers should be wary of?
So can I just start off, Sandra, saying how much I admire you?
Oh, thank you.
I think you have got a phenomenal, I don't want to call her a product, but she is a learning tool. In the aviation and health industry, we actually use low fidelity mannequins to be able to learn in a safe, non-judgmental environment. So I don't know about you, but I actually do learn from making mistakes. And
absolutely.
And I think what StandInBaby mannequin can do is, especially for someone who's new in the industry, they can take Sib and they can pose her and they can get a little bit of confidence and they can learn, without first going to newborns.
That's actually a really good point because you can experiment and try things with Sib and test it out to see if it's going to work. Whereas with a real baby, you have this very limited ability. Well, you're working with their sleep time. And so you have this very limited time to test things, try things. And then you've got the pressure of parents who are staring at you, waiting for that shot and making sure that you get it. You really don't have time to experiment or test or try things. And then, of course, once you do, you don't want to stuff it up. You don't want to get it wrong on a real baby. You don't want to accidentally, lift the chin too high, because this is one of the main things that you want to focus on during our tutorials is like the chin placement and things like that. Explain that.
So I think what Sib does for me and what you have done for me as well is you have given me some reassurance. I mean, I have looked at some of these photographs and think, I don't know how they've done that, and you have explained it an awful lot to me, and I do feel more reassured that babies aren't being put into these really unusual, very awkward angles that they really shouldn't be. And I think the fact that you've developed SID and now you've got these tutorials, it just takes it one step further in terms of safety. Yeah. So the minute that that family and the baby walk in, I think you need to be observing the baby and watching the cues, and then if you overheat the baby, you can tell if the baby's respiratory rate is going up, because you have sort of like a baseline of of when that baby was, or how the baby was breathing when it first came in.
It's actually a really good point. What are some of the things that photographers should look out for in regards to keeping an eye on ensuring that the baby doesn't have heat distress, because you have to remember that we're working in a really hot environment in our studios. So what are your suggestions there?
So what happens, Sandra, is that babies actually don't have sweat glands. One of the very few places they do have sweat glands is on the back of their neck or their head. So when you are swaddling them, you know, it would be a good idea to try and keep that area free from the swaddle. Babies can't sweat, and so they can't cool themselves down. What you find is when a baby is overheated, they will look quite red, they'll get really restless, they'll feel very hot to touch, but they will get this damp hair because of these sweat glands at the back of their head.
Right, so we should really be just watching out for definitely if your baby his hair is becoming damp, or they're becoming like that rosy colour.
Yes.
So what do you recommend if the baby starts to happen?
So, you know, generally as a rule of thumb, that babies, when we dress them, when we get up in the morning and we dress our babies, they should be dressed exactly the same as the parents, plus one extra light layer. So depending on where you're shooting the baby, you know, whether you're in a studio or a home, you really do need to think about the temperature as well as the humidity. Yeah. So, you know, think about if you've got a heater on, how far away that fan heater is. You know, ideally, depending on whether the baby is swaddled or dressed, whether in the nude, you need to have a lot of insight and a lot of common sense. So if babies are swaddled or wrapped, you really need to have a studio or a home that is, you know, approximately 22 to 26 degrees. But again, using some insight and some common sense, and, you know, look at the humidity and be observing your baby all the time. If you've got a baby that's in the nude, you know, consider temperatures of 26 to 30 degrees, which is really quite warm.
And so if my studio is already quite warm because I started the baby nude, and then I'm going to transition into some wrapping or some props where I'm going to put some blankets over the baby, do I need to have time between, or can I just turn the heater off, or what are you recommending there?
It's on an individual basis, Sandra. I think, you know, depending on your room and if you've got air conditioning going or not, or you can open a door and you can have a warm breeze through. It's so many, and that's why, you know, it just needs some common sense and some insight. But you know, it's also about experience, and it also is keep relating it back to the baby. You know, constantly look at your baby. Look to see if your baby's, you know, looking overheated or if they're looking, you know, cold.
When they get cold, I actually read somewhere that they can actually get really lethargic. So if that happens, are they going to sleep through the cues? Am I not going to notice them?
They are. So babies, unlike you and I, they don't have any brown fat, and they don't have the ability to shiver to make them, you know, to be able to warm themselves up. So what they do is they go very quiet and lethargic, and they conserve all their energy. So those cold babies aren't even going to cry to let you know that, you know, they are cold or they're unhappy, because Mother Nature is just telling them to conserve all their energy, and these babies just tend to go quite, you know, they go quiet and lethargic.
So how can I tell?
So their little hands and feet will be quite, you know, blue or pale. They'll feel really cold as well, but more so their bellies will feel quite cold. You know, their core temperature will be quite cold as well. Yeah. So you need to get them over to mum or dad, and you need to do some skin to skin. Yeah. If the baby hasn't warmed up with some skin to skin and hasn't had a feed, you need to seek medical attention. Okay. And actually, Senior were just talking about, you know, change of hand colours and that. I guess circulation is a really big issue for photographers as well, because we're putting them in very different poses and doing different things with them, and sometimes working with multiples as well. So with circulation, can you give me an indication of what is okay, what is not okay, what to look out for? Photographers who are taking pictures of babies who are newborns, like 48 hours old, there is something called acrocyanosis. And acrocyanosis is where the babies get quite blue, hands and feet, but they still feel warm. And what that is, it's the baby transitioning from intrauterine life to extrauterine life. And it is very normal. It is not normal if the babies have got still blue hands and feet after 48 hours. Okay, so in my instance where I am photographing, we generally go from 3 to 10 days is what we try for. We go much older than that, but that's the aim, what we're aiming for. So by the time they come to me, I shouldn't be seeing... You shouldn't. So the acrocyanosis should have gone within that time, after 48 hours. What you will see though, you know, you may get some babies who have got red or blue or pale hands and feet, or a little limb might go a little bit blue, and that's due to positioning with poor circulation, or there's a weight of maybe a twin's head or in frog pose possibly, where the baby's got the weight on the legs.
Yes.
So it is not a normal thing to see.
After 48 hours, if I do start to see any change of colour in the hands, feet, or anything like that, I should reposition the baby, because it's not going to be natural, or it's not going to be from that condition you were talking about.
Especially if it wasn't there before. So this is why it's really important when you're undressing the baby and you're swaddling the baby, and you have a really good look at the baby.
It's actually a really good point, because so with the condition you're talking about, it's there like for the term of that time, and so when I undress them, I'm going to notice those things.
You will, and it's normal. So the baby will, the baby's hands and feet will be warm. Whereas in a positioning pose, or if the baby is cold, the baby will feel cold. So that's different from when you were, first put your hands on the baby. Things have changed from when you first put your hands on the baby.
And if the baby's cold or I've cut off circulation, I should definitely be repositioning from that point.
You should, and you should warm up the baby.
Okay, no, that's really good to know. Is there any specific conditions with newborns? And I'm thinking like reflux, I'm thinking hip dysplasia. Is there any things like this that us as photographers should be wary of?
So things like hip dysplasia, the baby would have been diagnosed with it before they've left the hospital, and they will have a brace on. Under no circumstances should you take a brace off. The parents would have been educated on this, and the babies are even bathed within the brace. You just need to be able to work around the brace when you're photographing babies who've got hip dysplasia.
How long are they in their braces for?
It depends, Sandra. It's just very much individual.
So I guess if the parent doesn't want to postpone the shoot until the baby's a bit older, then we just literally have to work around it. Maybe think about ways we could hide it, or positions like on their back might be okay.
I think what needs to be done is you just photograph the baby in the brace, and I absolutely understand parents who want to have photos of their newborn, but it's who the baby is at the time.
Yeah, so maybe capture that milestone, that this is, you were in a brace for a little bit, and then come back again later. Maybe we do a small mini session now to show, their transition from the massive journey that they've had to get to this point. Absolutely. So what is reflux?
So reflux is basically, it's that little sphincter down in near the tummy that, might be a little bit immature, and it's letting some of the milk come up, into, the food pipe. And the babies are, just having a difficult time to, coordinate sucking and swallowing, breathing, and they get a little bit frightened. A lot of babies can just have these massive big vomits, and it doesn't disturb them, but you must always ensure that the airway is safe.
Is there any poses that you wouldn't recommend, or are they all okay as long as we are very cautious and mindful and just due care, really?
So if you've got a baby who is really, spitting up a lot or is vomiting, you really don't want a lot of pressure on their bellies. And, preferably you want them head high. You would never put them, in a pose where, their head is down. So head high, and never take your eyes off the ocean. You always want to be watching that baby's face, and watching what that baby's doing, and, their breathing, and, their colour and everything.
Okay. We've also spoken a bit about hygiene in our studio. So what is your recommendations?
So if you've got babies who are coming into the studio who are just 24 hours old, babies have got a very immature immune system. They're not like you and I. They don't have the ability to be able to localise infection. So if you and I, say, get a cut on our finger, we can localise, if we do get an infection, to our finger. Babies can become very unwell, and it becomes systemic, so they become quite septic where they need antibiotics. Babies are quite susceptible to infection, especially, newborns where their umbilicus, hasn't fallen off. And this is where we need to be really meticulous with hand hygiene. Hand rub is perfectly acceptable, but every time you touch a surface, whether you touch your hair or you touch the props, you need to go back to the hand rub. The minute that your hand then becomes sticky or is visibly dirty, you need to go and wash them with hot soapy water.
Great. And to go back a step, what about jaundice?
So jaundice is where the babies get yellow, and most babies are sort of, they stop being yellow sort of around about 7 days. My advice would be that jaundice babies are quite lethargic, and they need to feed quite frequently, anything between 8 to 10 feeds a day. So because they're already lethargic, if we photograph the babies, we're really going to be using up the energy that they probably need to take in feeding. So have a discussion with the parents.
And maybe postpone if we can, because you said if it's up to about 7 days, that's still a good window of opportunity to get them into the studio in an acceptable sort of time.
And you know, you want a well baby.
Yeah,
so.
absolutely. Yeah. But if the parents are sort of pressuring, you know, oh, my other baby was photographed at 4 days old, I really want my baby photographed as well. Do you recommend definitely just not doing it, or is there ways that we could do it safely?
Every baby is an individual, and every family and every photographer is an individual, and really it's common sense and it's insight and it's being comfortable with the decision that you've made.
If you do decide to move forward, just make sure that you're stopping all the time, that your baby's getting that feed that they need, and talking to the parents about the situation and moving forward.
So as a photographer and you're quite unwell, you need to cancel that session. The same thing with parents. Parents should really, if you know their baby is unwell or not behaving the way they should, they need to reschedule that appointment as well.
Yeah. So what if I as a parent have a sick child and I'm photographing from a home studio? Do I need to cancel it then, or am I okay as long as I just keep that child away from the session?
Again, you know, it's really difficult, Sandra, because that child could have like a snotty nose and they're running around and they're touching all the surfaces, and that's not what you want when you've got a newborn in. But you've got to think about the other newborns that are coming in for the other sessions as well. Yes. So you just want, you know, your studio to be as clean as you possibly can. You know, you need your surfaces to be able to be wipeable. You know, if you've got a back prop here, as beautiful as what it is, you know, one back prop, one baby, this then needs to go into the washing machine.
Absolutely.
All of your wraps, your swaddles, straight into the washing machine after they've been used.
Absolutely. And I remember that you were saying that even for things like support pillows, if they can't be washed, they need to be able to be wiped down. Is that right?
It does. Or, you know, alternatively, you could use something like, you know, a pillowcase or a disposable cover. You know, one of the things that, you know, you could possibly think about is asking the mums to put a hanky or maybe a bib, you know, into her shirt on the way to the session. Right. And then if she's got an unsettled baby, then what she could do is, you know, you could put that bib with mum's smell underneath it, you know, just underneath, say, you know, your back prop. And babies, you know mum smells, and it might just, you know, soothe them into going back to sleep.
That's actually an excellent suggestion. I love that idea. So as a photographer, should I make sure that all of my vaccinations are up to date?
Sandra, that's something that only you as a person can answer, but you know, you have to remember that newborns are not eligible for vaccinations for until they're 6 weeks old. Anyone who is working with children or babies, they have a duty of care to vaccinate themselves. And I know myself, I have a flu vaccine every year, and I am fully vaccinated for measles, mumps, rubella, including whooping cough.
And they're the same ones that you would recommend for us, would you?
Yes, and I think, you know, if you don't want to be vaccinated, again, you have a duty to inform the parents and your employer, if you're not self-employed, that you are not vaccinated.
Okay, so either get it or tell your parents that you, the clients that are coming in, that you don't have it, so they can make the decision that's right for them. Culturally, there's a lot of different ways to settle a baby. Is there a technique that you recommend, or how do you suggest that we work with babies?
So Sandra, I think you always need to go back to the parents and ask the parents how they settle. But you know, ideally, you just want that baby to be contained, and you just want that you know, as you were doing so beautifully before, when you had one hand on the baby's back, the other one on her, you know, on her little bottom, and it's just nice to know that she just wants to know that you're there, you know, without any padding. You know, if you're photographing a baby who's a little bit premature, stroking the baby is actually quite painful for them on their skin.
Really?
So yeah, they really don't like it. And you'll get a baby that's quite overstimulated then, and they will become quite restless.
Actually, it's a really good point, because I had never really thought about it until you said that, but their skin really hasn't been touched before. It's been very contained, and I guess it would be very sensitive to touch and to the feeling of different textures on their skin.
And it's got to do with, you know, a lot of their immunity, their central nervous system immunity. Yeah. So yeah, and you know, again, especially for a premature baby, if they've been really unwell in a nursery, a lot of their touch has been quite noxious. So you just really want the parents to be the ones to touch them. They don't need to be overhandled.
I've actually noticed that. I've had a few premies come into my studio, and if they've spent a long time in, like in the
intensive care unit,
they get pricks in their foot really often. And so I've found that babies who have spent time in that environment, they actually don't like their feet to be touched.
No, they'll jerk away.
Yeah, so it's actually a really interesting point that you've made there. Thank you so much for joining us and helping to educate our industry. I really look forward to going through some poses with you and discussing newborn safety. If you are interested in following the rest of our tutorials and seeing what Anne-Marie has to say, make sure you subscribe to our YouTube channel. Thank you.